This video relates to Chapter 4, Principles of Communication Assessment. I think it's important to understand that the outcome or the reason or purpose for evaluation or assessment, and that is you as a clinician will need to determine whether there is a presence or an absence of a communication disorder. And so don't take that lightly. That is something that you really need to focus on. Is there really a true communication disorder in terms of that? So that is really the bottom line. Whether you're working with an adult, whether you're working with an infant, whoever that may be, it is your job as the clinician to determine whether there is the presence of a communication disorder. Your textbook and the PowerPoint will talk about lots of different things that are included in a communication assessment. But one of the things that I want to bring to the forefront is one that is sometimes forgotten or overlooked or we forget about because we don't have time. And that is observation. There is a lot of information that you can gain through observation by observing a student in a classroom, by observing an adult interacting with his or her family members. So make sure that those observations occur. They don't always have to have a tool. There are many observational checklists, tools, etc. that you can use, but as you become an experienced clinician, you'll be able to observe and gain information. And sometimes I think what we need to do is stop talking, listen and observe more. So remember that as you're doing your assessments in terms of that. Another thing I want to mention is please remember that you as a speech language pathologist need to ensure that when you assess an individual that you assess all areas of assessment. Many times I think that we see maybe a referral. We have information that says this child has issues with language, and we don't always think about hearing, and we don't always think about speech. We don't think about the oral mechanism. So just keep that in the back of your mind that you need to always assess or have information about all those areas. Now that doesn't mean you need to give a test in every single area. However, you should have information if it's informally gained through a case interview or through an observation, some way that you can address that you feel confident that that client, that student has that information, that there isn't a concern in that area. So as you're looking at communication assessment, always remember it's a comprehensive assessment, and that a lot of times we can gain a lot by listening and by watching or observing. So don't forget the observation part of your assessment.